In a health alert this morning, doctors in the Yakima Valley are trying to spread awareness about a disease caused by blocked arteries in your legs. Sean Chitness is standing by live in Yakima this morning with more about the disease. Sean?
Melanie, good morning. We are back here at Yakima Vascular Associates, joined again by Dr. Justin Robinson, talking a little bit about the treatments for PAD. And doctor, you said initially the options relate around lifestyle changes or medication, right?
Yes. Some of the lifestyle changes you can do are keeping your blood pressure under control, keeping your weight under control so you don't get too heavy, getting regular exercise 3 or 4 times a week, doing just walking is okay, and keeping your cholesterol under control. And never smoke, and if you are diabetic, keep your blood sugar under control.
And those are things you would talk about in a room like this, but ultimately if those initial treatments don't work out, you would head into the cath lab, which we have some video of. Talk about what you do inside there.
In the cath lab, we'll often put in a stent or use a balloon to balloon open the narrowing in the artery. And it goes in through a little puncture at the groin, and that gives us access to the arteries all over the body. And a wire is fed up through the narrowing, and then a balloon is passed up over the wire and used to dilate out the narrowing, and then ultimately a stent is put in. And the patient's awake. There's no general anesthetic, although we give them medication that makes them kind of drowsy and use a local anesthetic in the area. Most of the time that just is a same-day kind of procedure, or sometimes the patient will stay overnight and go home the next day.
And you have an example of just how small this very initial or simple piece of surgery is there. So talk to us a little bit about the makeup of it.
Well, this is a stent that we sometimes deploy in the artery to act as a brace to brace open the narrowing in the artery. And it's a special kind of wire mesh that's in a shape of a tube like an artery, and it's crimped over a balloon. And then when the balloon is passed up into the narrowed area, we inflate the balloon, and it inflates this stent, and then the balloon is brought back down and pulled out, and the stent remains to keep the artery open.
Right, so an impressive piece of medicine. We're going to have more with the doctor in our next hour, talking a little about some of the other treatments related to PAD. Live in Yakima, Sean Chitness, KNDO, right now.